Thank you. I'd like to thank Dr. Palma for inviting me to come to Italy. I haven't been here for 25 years and I'm glad to be back. This is a wonderful city. I want to talk to you a little bit about fat grafting today, and the title is about science, but I want to focus more on the art. And I think it's important that we are not only surgeons, but we're artists, and we see the face with that sensibility. So we're going to build a new vision of seeing today. The left side of the brain will be something we'll focus on tomorrow morning at 7 o'clock. We're going to be talking step by step how to do it with a lot of video. Today we're going to talk about seeing the face. And this whole section is about seeing the whole face. So the right side of the brain is where I want you to engage, if you will. If you look at Sharon Stone over a period of about 20 years, she looks older, and it may be some of the sun damage. We tend to attribute a lot of the other to dermatocalasis, cavity, some other element that we're so accustomed to seeing. But if you really look at those brows and measure them from one side to the other, you'll see that there's very little gravitational component. The right eyelid is down a little bit, but if you look at this side, it's actually gone up a little bit. The biggest difference is not gravity, but it's a loss of volume around the eyes. And so that loss of volume is so very important to see. If you take a narrower time gap from early to late 30s, you can see that skeletonization already beginning to occur right around the eyes, around the central cheek, and around the jaw. And that's something that when you begin to see, there's an epiphany, this light that goes off, and you start to see that everything is not just gravity. In fact, I would argue it's actually a smaller component. What's so important when we talk is we communicate well to our patients. A lot of people say, well, my patients won't buy fat grafting. They don't get it. Well, whose responsibility is it to communicate that information? It's yours. If you don't believe in it, they won't either. So I like to use simple metaphors, if you will. And I'm going to talk about the aging like a glass of water. Well, that's a simile, I guess. But we often have, you see right now in these celebrities with way overfilled faces, and you think, well, is that the answer? And well, that's exercising the left brain again, and not really understanding the face from an artistic perspective. So this evolution is we actually go with too much fat. When you ask a woman when they like their face the most, they often tell you early 30s. They usually don't tell you 18 to 21. Because in that earlier time bracket, there's a lot of volume. So if you just think for a moment, actually a 1-year-old has a lot more fat than a 10-year-old. And a 10-year-old has a lot more fat than a 20-year-old, and so on. And so if you take the constraints of aging in terms of weight stability, so you're not gaining weight, you'll see that you basically just continue to hollow. So ideal is typically in the early 30s more than anything else. This glass of water idea, again, is for me a simple simile to talk about how we see the aging of the face. So I talk about being too full and then hitting an ideal, and as you get older, that glass of water continues to empty, minus weight changes. And so you want to fill it appropriately. And people always ask, how long does fat last? And I say it's permanent minus ongoing aging. So you're going to deliver the yellow, bring it back up to an ideal, but every year you lose a little bit. So oftentimes on patients every couple of years comes back for a little bit of a filler touch-up, and I look at that fat as the ability to really fill the face up, and then the fillers to make small adjustments, because fat is not a permanent, not a perfect correction. The people that try to sell a perfect tear trough, a perfect cheek, a perfect fold, a perfect jawline, they're going to get in trouble. Fat is to fill up the volume really up to about 80-some%, and a little bit of micro corrections you need to finesse with fillers. That's my feeling, at least. I want you to understand the facial shape. And what facial shape are we talking about? It's an oval. It's an oval from a frontal perspective. A lot of times when you see fat grafting results, you see them from a 3/4 perspective or a side view. But how do we engage each other emotionally? How do we engage each other socially and professionally? We do so from a frontal view. So I'm going to talk to you about what that oval means. First, we have to understand in a blink of an eye, we judge someone's beauty, attractiveness, instantaneously. And how do we do that? It's facial shape. We can see someone 20 feet away before we even see a wrinkle and already gauge how beautiful they are or attractive or handsome they are very fast. It's that shape that defines that youth. And as I was mentioning earlier, in a very young state, it's very round. That continues through the teenage years. It continues even into the early 20s. And then there's slow transformation where there's some loss of fat, of facial fat, that begins to sculpt the face inward, and it becomes a little bit more pronounced by the late 20s, where the triangle becomes a more dominant feature. And then a little bit more heart shape as we get into the early to mid 30s. And that becomes more dominant in the lower face because the exposure of the skeletal structure becomes more of a predominant feature, and it becomes more masculine, as you heard from Dr. Adamson. So you're starting to see a lower facial dominance. So the real goal is to bring the attractiveness back into the eye zone. So you're starting to see that inversion of the triangle. And so a way that I always thought about it was flipping the triangle. But I think another thing that's so important, which you'll hear in a few minutes, is really understanding that the transitions of the face should be muted or softened. So I like an oval. I think the oval is the best expression of a face, and I'm going to walk you through different ones that I've done to have you understand it. And the thing that I've really begun to think about more recently is what I call a double convexity. What that is from the frontal view, this area and this area are convex. As we start to age, you see a scalloping of the temple and a scalloping of the mid-face. And a lot of what you're going to see with these photos is going to be focused in this scallop. So this is more of a recent addition in the last 6 months. So I don't have a lot of long-term follow-ups and thinking about how important the temple is. But it's a double convexity versus a double concavity. And that helps complete that ovalization of the face. So let's talk about designing ovals. And again, this is going to be sort of how I see the face. Here's a lady that if you look at her, she has a relatively heavy lower face. You don't want to put a lot into this outer lower face because it's going to accentuate it. So instead, you want to bring the accentuation to the face. I'm not showing you all the numbers. I'm just showing you how I design the mid-face and talking about that component of ovalization. I think it's so important. So it draws the mid-face forward. So you try to keep yourself from doing too much low down. Asian faces tend to be rounder. So in this buckle, though, is a little bit of suppression, so I want to do a little bit of work there. And I don't want to put too much out here. It's going to bring too much width to the mid-face. So this is just showing you a little bit more conservative buckle treatments. These are CCs, by the way, and everyone's going to be different. In your hands, this may be completely different from mine. But more, it's the proportion I'm trying to show you, not that you have to memorize. You put 0.3 cc's in the lateral cheek. It's more the total aesthetic of balance. And so just to divert myself for a moment, we heard a lot about symmetry being beauty, and I would actually argue that that's not at all what I look for, because it's unattainable. What's attainable is shape, and in terms of balance. And the word balance that I use, and that's what I'm trying to articulate here, is think of a glass of water on a television screen. If I asked you how big this was, you would say, I have no idea if there's no reference points. I put a shot glass next to it, it looks large. I put a pitcher of water next to it, it looks small. And what I really see when I see models is a relative proportion of everything in balance, and that's really what we're trying to achieve here. This lady here, to me, looks like she needs a little bit more in the buccal zone, but this whole mid-face is quite empty, so I want to bring some accentuation and width to this area. So for her, I'm putting a little bit more there and a little bit more in the buccal to create that ovalization pattern that we're talking about. Here's a lady where if you look at her, she's got a heavier lower mid-cheek and really quite empty in this area, including the buccal zone. So I'm just putting a little bit more in this area to try to bring harmony out here. But if you argue, I would put more in this area to create a better double convexity, because there's still a little bit of concavity I've left here. And if you look here, there's a lot of emptiness. This is quite skeletal in nature, so you really want to build this one up. And so building it up to me also means if you're looking at that scalloping of the bone edge coming in from a frontal view, the lateral component of that buccal zone, this is all sort of, I divide the buccal into 3 areas. That lateral subzygomatic region to me is so critical to create a nice ovalization of the face. And I think this is even more pronounced. You see that scalloping in of that subzygomatic region, and you want to be even more aggressive, in my opinion, to really accentuate that lateral component. So it's not to widen and make the face fat, but to bring harmony to it. And this one, it's more sort of central, and you can sort of see that I'm focusing really in this zone right here to bring that face into a better ovalization. This Similar story, just a lot more aggressive in terms of total volumes, trying to get this zone to balance in very well. This is, again, very similar. You're seeing how important volume is in terms of this transition. I think what a major flaw I see in volume of the mid-face is it doesn't take the buccal into consideration, so you get this over-exaggerated central anterior cheek, which just doesn't look pretty. You've got to mentally conceptualize the face into multiple subcomponents, and I think that's very helpful to see the face differently. I want you to look at these twins, because with the twins, I think it's going to give you that blink idea, that instantaneous feeling about youth. So look at the very small image. If you look, these are identical twins, 42 years of age. She's never had anything done because I know that she's opposed to cosmetic enhancement. And this is my patient almost 5 years after a fat transfer. They're 42 years of age, and if you look very carefully, something about her looks younger. Your brain just knows youth. There are no wrinkles there. If you look at the nasolabial grooves, they're about the same depth. The lips here are painted a little bit thicker than this one, so these paper-thin lips don't need to be augmented, but you look at this, you think, well, maybe she needs more lips, her folds need to be filled in, she may need a tighter jawline, but that jawline is about the same. And if you look at the brows, somehow she's lifting her brows up and they're creating a little bit more of an arch. That brow's lower, so everything we think about is not what creates youth. Here's the answer. If you look at the anterior chin, that volume loss here, it's the transition from a full lower cheek to an empty outer cheek and a flattening or skeletonization of the brow. That's so important. And this is 37 and 42. And I didn't do touch-ups or fillers, and this is her face now at about 10 years prior at 32. And you can see that they almost look like twins, and they almost look like twins, although every image is of this woman except for that one, her sister. Light. One thing we don't think about is how light interacts with the face. So I take my photographs without a fill flash, because when you're dealing with volume, you need to understand how light interacts with the face. Do we walk around with two fill lights in our face? No. We walk around with what? Top-down lighting. So I have a very small room with no ambient light, so you have controlled distances. But I allow top-down light to accentuate. Otherwise, sometimes, you know, if we have top-down lighting, we sometimes look like Nick Nolte after a bad night. But think about light on the skin. How does it fall on the skin? It falls top down, almost always, except if you're at a high-end boutique dressing room where it's so diffuse you can't see anything. So you want to replicate that so that you can have the patient understand how they see themselves. It's top-down light at the beach, it's top-down light on the streets, and it's top-down lights inside the office. So that is the thing that I try to replicate so we understand the accentuation of shadows. Because the minimization of shadows, the accentuation of highlights, and the minimization of transitions really, to me, is a fundamental element of beauty. And that's why when I'm even injecting fillers, I have my staff trained to see what I see. So as I'm filling over here, they have a different light pattern. And they're saying, hey, Dr. Lamb, you may want to hit over here. And I'm looking there, they're right. I've trained their eye as an artist to see where a face has better transition. So we think about it, it's really deflation of the balloon that we need to refill to create the light convexity on a face rather than stretching it over a skeleton, which only sometimes can accentuate transitions rather than de-accentuating them. So think about radiance of light. Longevity, how long does fat last? And when I was studying for the hair boards, I really started to understand that perhaps if fat is going to last you 1 or 2 years, why would it get up and walk away? Does a skin graft, does a forehead flap 2 years later necrose? No, it's there. It has blood supply. It's going to die within the first year. So I started to look at my results over a period of a few years and understood the evolution from the template of hair restoration. And hair takes about 6 months to 24 months to slowly grow in. It goes through these periods of primary, secondary inosculation, all the way to neovascularization. And you see these changes, these subtle changes, if you photograph your patients and watch them. I think a lot of doctors that don't get longevity, either it's due to technique or they're not following their patients long enough. They're looking at them at 3 months and going, it's gone. Because they're looking at all that distortion that at a month where things are stretched out. Well, it's not going to do that. Fat is not perfect. If I'm here to sell you fat as a perfect vehicle to manage all aging, well, then I've done a bad job. It's a component, but it's a component that works in tandem with other elements. And this is what I sort of came up with, this idea that we go through this overarching swelling, and sometimes right here it looks perfect. because everything is stretched out, and you got to tell the patients at a month it's not perfect. And then somewhere in this period of time, it just doesn't look as impressive, but over a period of 1 or 2 years, it gets better. Not perfect, but better. And then there's a little bit further aging. So remember that analogy of the glass of water. Again, try to communicate in a language that the patient understands well. So the other thing that if people do hair restoration here, they understand the idea of donor dominance. What that is that hair taken from the back of the head and moved to the front will behave genetically like the hair on the back of the head. And I think that's very true with fat. Fat taken from the belly will behave like that. And I've had 2 or 3 patients that I simply thought looked horrible. And a large part of it was I live in Texas and they eat terribly. And the food that goes into the gut goes into the face. So one of the biggest limitations, and this is the one I underscore to them, is weight fluctuations. And you want to be careful, especially if they're, I just lost 50 pounds and I'm ready to do fat graft. Well, what is your history? Well, I lose and swing up 50 and drop 50. When you get into the 25, 35 pound range, I think the face can look overinflated when they gain the weight. So you got to be extremely careful. On the flip side, too much fat doesn't look pretty. I rather undershoot them. I rather even do a little touch-up with a filler. I rather go back and add a little fat. So people always ask, do you want to use PRP? Do you want to use different types of volume enhancers? And obviously the answer for you is going to be what's in your hands and what you've experienced. In my hands, yes, sometimes my fat is a little less than I would like to see. But I don't ever want to get in a situation where the person looks like a pig, because that doesn't look pretty. Less is more in certain respects. So I don't really want to get into things that could enhance the take of fat. So let's look at the evolution of fat over time. This is a week, some bruising, some stretched look. At a month, it could look pretty good because all the wrinkles are gone, right? Now, the only other thing I did for her is I did some Botox over that period of time. And at 3 months, it doesn't look that bad, but it's come down. And at 6 months, it maybe has come down a little bit more. And over time, at 11 months, and then into 15 months, it actually sort of gets bigger. Does it happen always like this? No. There's variability. Just like hair restoration. Sometimes I don't see growth until 14 months. Sometimes I see explosion at 4 months. So you've got to understand there's a variability in the nature of that evolution. But so long as you understand there's an evolution, then you can appreciate that your patient is at a point in time that's evolving rather than a static one. This is not like Restylane or hyaluronic acid you're filling in. On Friday, I'll be talking a little bit about the difference between implants and fat, and then in Vegas in a few weeks, I'll be talking about fillers versus fat and how I sort of go through the strategy of that. So I just want to leave you with one point for the talk on Friday, which is like replaces like. If you've lost skeletal tissue, replace it with skeletal tissue or implants. If you've lost soft tissue, replace it with soft tissue. I think that helps. Obviously, you can do the other way around, but I think this is a good policy to help with making things look as natural as possible. The big topic we talk about is stem cells. How are they? Well, as most of you know, the adipocytes in the belly and the thighs have about 21% adipocytes in there. They're the highest content in the entire body. I just try to be careful with using the word stem cell facelift, stem cell. I think we don't know well enough to go and try to throw that marketing term around. I think we got to be a little bit more conservative, especially as scientists out there, of what we're offering a patient. So I tell them if there's a great benefit, great, but if it doesn't happen, don't blame me because I don't know. Maybe you need a peel, maybe you need a laser. So I leave you with this image again. I think throughout this whole week, especially when this beautiful Italian country, where there's all the art around you, be inspired by that and think as artists. Thank you.